A controversial 11th hour anti-abortion amendment is threatening actually to blow up the next stage of health care reform. Nancy Pelosi allowed the amendment to win the vote roughly of a dozen conservative Democrats. It infuriated a lot of Democrats in her caucus and in the Senate. Senator Barbara Boxer told me today that she's secured the votes to block the amendment in the Senate. But that could jeopardize the votes of Ben Nelson and some other holdouts. Meanwhile, pro-choice groups are considering political warfare next year on Democrats who voted the other way. Joining me now is Congresswoman Nita Lowey from New York, who is the former co-chair of the pro-choice caucus. Congresswoman, thanks for your time tonight.
Thanks, Ed. It's good to be with you.
Have we hit a major stumbling block when it comes to reform? Can this be, in your opinion, resolved?
I want to make one thing very clear at the outset. Current law now prohibits any federal funding going for abortion. That's it. No federal funding can go for abortion. So what was outrageous is that the last minute, after more than 90 hours of briefings, discussions, the Speaker was bringing into her office in a very courageous way all parts of the caucus. She got consensus. And at the last minute, the anti-choice extremists said, current law is not good enough, and they brought up the Stupak Amendment. Now, we're going to work with the President, with the Speaker, with the Senate, to make sure we have a compromise that will pass. Look, this is not the way to deal with the pro-life, anti-choice movement. We should be working together.
Sure.
Be excited about the health care, providing prenatal care, providing all kinds of care for women who need it to prevent unneeded abortion.
All right, this is the president last night in an interview, and I want to get your reaction to this. Here's how he sees this situation.
This is a health care bill, not an abortion bill. And we're not looking to change what is a core principle that has been in place for a very long time, which is federal dollars are not used to subsidize abortions. And I want to make sure that the provision that emerges meets that test, that we are not in some ways sneaking in funding for abortions, but on the other hand, that we're not restricting women's insurance choices.
Congresswoman, are you satisfied with that answer? Do you think the president is strong enough, or is he fence riding?
The president must be strong enough. The men and women who have been fighting for the right to choose for a long time are going to work together, House and Senate, and all the people out there, all the supporters out there of the right to choose, to make sure that the language in this bill continues to prevent federal funding for abortion, but does not restrict a woman's right to choose an elective abortion without federal funding.
If it comes out of conference committee the way it left the House, how will you vote?
We're going to work as hard as we can to create a compromise, because the language that is currently there in the Stupak Amendment is unacceptable.
Compromise on abortion, that would be a first.
No, I didn't say compromise on abortion. Compromise on language that prevents federal funding for abortion. That's not a compromise, but does not prevent a woman to choose to terminate a pregnancy.
Congresswoman Lowey, appreciate your time tonight. Thanks so much.
Thank you very much, Ed.